Brings us to what is being done right now to prevent the spread of COVID-19. There is one man who is working right now on a COVID-19 program to help with so many disparities that we've been talking about over the past few months in healthcare. Also, police reform is a big topic on a federal level. So joining me right now is New Jersey Senator Cory Booker. Senator Booker, thank you for joining us once again.
It's so good to be with you guys. Thank you for having me.
Yes, always good to have you here. So I want to begin this morning, though, with the uptick in cases around the country. Areas like Florida and Texas on track to run out of hospital beds this week. So what is the federal government doing to contain this problem, or not doing, in your opinion?
Well, it's really frustrating that we, unlike other countries from New Zealand to South Korea, that have had strong national leadership, national directives, have been able to get out of this crisis. Well, we are an outlier globally. And with only 5% of the planet's population, we have about a quarter of the cases and really outlier in rates of death. So we need strong federal guidance and leadership that unfortunately we're not getting from the White House. What I'm battling right now and hope to get done in this next session in Congress is to get what the House of Representatives passed, the HEROES Act, to really be the law of our land. And that means getting a lot more resources for our state and others to meet with this crisis. Everything from more help for our small businesses, expanding unemployment insurance to help to begin to dampen the economic damage that is being done, as people should be able to work through this period. Number two is a lot more healthcare response as well.
Senator, I want to get your take on some mixed messaging that we're hearing from the president, the CDC, Dr. Fauci. The president saying yesterday that they've tested 40 million people and 99% of those cases are totally harmless. Your take?
Well, we know that that's factually not true. His own epidemiologists are giving out different data. And that's the thing that this president doesn't seem to understand. You can't argue with science. You can't politicize facts. The reality is we are facing a global pandemic here in America. It is on the rise in most states and in our nation as a whole. This president needs to align himself with what his own scientists are saying. His failure to do so is costing lives.
Right.
He should be setting an example himself, wearing a mask, urging this country to rally together in common cause against our common foe, this virus.
Should there be a nationwide mask mandate? Governor Phil Murphy says so. And if so, who exactly mandates it? Can Congress?
Well, again, there should be, and whether we do it in law or in practice, what they call a de facto a mandate, is if you have an alignment, everyone speaking with one voice across political aisles. You don't have to go as far as over the border or northern border to see what a country that does that. They're conservatives and they're liberals actually joined together in nationally telling local leaders what they should be doing, and they unified as a country, complementing each other in the way, and have way lower amounts of cases than we do. And so, again, this is not beyond our capacity. We're the United States of America.
Right.
But this president is trying to make us the divided States of America as he approaches this.
So I want to get to this. You and Representative Robin Kelly of Illinois working on a grant program that you mentioned to tackle COVID-19 inequities. So this would really put money into health programs in underserved communities, which really, in our area, have been affected the most. Briefly, how would the program work?
Well, again, this is common sense. We have a state and nation that people who are disadvantaged don't have often the resources to get in a car, to go tested. To get tested. So this is a program that really removes a lot of those barriers, levels the playing field to access to healthcare, access to the kind of issues of testing, or being able to socially distance, or even making it easier for people that are suspected of COVID to find ways to socially isolate with resources for hotel rooms and the like. This is not something like that we don't know how to do. We need to understand that where there is extreme concentrations of cases from nursing homes to minority populations, if we apply the resources there, we can help to stop the levels of death and infection, and actually help to elevate human well-being.
Senator, we're running out of time here, but I want to get your take on another big topic that's been happening, and that's about police reform, right? The voices are being heard around the country, specifically in our area. Many local governments have been making changes, such as Newark and Jersey City. However, What about a national level? What are we seeing with the Justice in Policing Act, which was passed by the House but not the Senate?
Well, I'm honored to have authored this bill that passed in a bipartisan way, actually, out of the House of Representatives. Mitch McConnell, who calls himself the Grim Reaper, is stopping right now us from even having a vote on a bill that will have significant change, and instead has supported a bill that wouldn't do the things that you see Republicans and Democrats widely supporting, like banning chokeholds, racial and religious profiling, no-knock warrants. America is speaking. There are folks that want this done, and we're seeing, again, bipartisan support generally amongst the electorate. But unfortunately, the Senate is looking to do more substance right now under Mitch McConnell more symbol than substance. Yeah. And we're fighting to change that. And I'm confident that we will be victorious in the long run.
To be continued for sure. Senator Cory Booker, always good to have you on. Just to end on a light note here, once everybody is out of quarantine and back up and running, what is the first thing you'd like to do?
Well, hug.
Right?
I'm a hugger, and just human contact. That's really rough. So I just love people and love engaging, and this has been a difficult stretch for me. So I'm looking forward to getting back in just everyday human contact.
I agree with you, my friend. I certainly miss human connections and human contact. Thank you for coming on once again, Senator Booker. Appreciate your time.
Well, you'll have to suffer through a bear hug when I see you in the future.
It's welcome. When you're back in this studio, it is welcome. Thank you very much.